Hi viewers, welcome to my channel. Today we will be discussing overview of vasculitis. Our objective will be definition of vasculitis, types of vasculitis along with their symptoms, and in the last treatment of vasculitis. Now let's discuss what is vasculitis. Vasculitis is a term for a group of rare disorders that destroy blood vessels by inflammation. These blood vessels include arteries and veins. The inflammation of veins is called phlebitis or arteries is called arteriitis. Now let's discuss types of vasculitis. Types of vasculitis include large vessel vasculitis, medium vessel vasculitis, and small vessel vasculitis. Large vessel vasculitis include giant cell arteriitis, Takayasu arteriitis, and polymyalgia rheumatica. Now let's discuss giant cell arteriitis. Giant cell arteriitis, also called temporal arteriitis, is a type of vasculitis that often affects the arteries in the head and neck. It mostly occurs in female over the age of 50 years. Clinical features of giant cell arteriitis are aching and soreness around the temples, jaw claudication, unilateral headache, double vision, and irreversible blindness or vision loss due to ophthalmic artery occlusion. Now let's discuss polymyalgia rheumatica. Polymyalgia rheumatica is a type of vasculitis that is closely related to giant cell arteriitis. It mostly occurs in adults over the age of 50 years and is more common in women than men. Now let's discuss clinical features of polymyalgia rheumatica. Clinical features are pain and stiffness in the shoulder, neck, and hips, which often bursts after waking up, high-grade fever, extreme tiredness, loss of appetite, weight loss, and depression. Now let's discuss Takayasu arteriitis. It is also called pulseless disease. It is a type of vasculitis that mainly affects young women, usually younger than 40 years. It affects the main artery from heart as well as major arteries which are branching it off. Now let's discuss clinical features. Clinical features are extreme tiredness, fever or a high temperature, weight loss, muscle pain, joint pain, skin nodules, dizziness, shortness of breath, painful numbness or cold upper extremities, and ocular disturbance. Now let's discuss medium vessel vasculitis. Medium vessel vasculitis include Kawasaki disease, polyarteritis nodosa, and Berger's disease. Kawasaki disease. Kawasaki disease is a condition that mainly affects the children under the age of 5 years. Clinical features of Kawasaki disease include high-grade temperature that lasts for more than 5 days, along with polymorphous desquamative rash, cervical lymphadenopathy, strawberry tongue, hand-foot changes, conjunctival injection. Kawasaki disease may also develop coronary artery aneurysm, rupture, or thrombosis, which may lead to death. Now let's discuss treatment of Kawasaki disease. Treatment includes intravenous immunoglobulin and aspirin. However, aspirin is not usually recommended for children under the age of 16 years. Now let's discuss polyarteritis nodosa. Polyarteritis nodosa is a rare type of vasculitis that particularly affects the arteries supplying the gut, kidneys, and nerves. It usually occurs in middle-aged men. Now let's discuss clinical features of polyarteritis nodosa. Clinical features include myalgia, arthralgia, abdominal pain, particularly after eating, melena due to bleeding and ulcers in the gut, rash, neurological dysfunctions like pins, needles or numbness, hypertension, and renal damage. Now let's discuss Berger's disease. Berger's disease, also called thromboangiitis obliterans, it affects the blood vessels in the legs and arms which lead to reduced blood flow to the hands and feet. It is more common in heavy smoker male of younger than 40 years. Now let's discuss clinical features. Clinical features of Berger's disease include intermittent claudication, superficial nodular phlebitis, Raynaud's phenomena, and gangrene. Treatment of Berger's disease is smoking cessation. Before moving to a small vessel vasculitis, let me ask you if you have any query or any problem. You can write down the comment below so that I would reply you. Now let's discuss small vessel vasculitis. Small vessel vasculitis is divided into ANCA positive and ANCA negative. ANCA positive is further divided into C-ANCA positive, which include granulomatosis with polyangiitis, and P-ANCA positive, which include eosinophilic granulomatosis with polyangiitis and microscopic polyangiitis. ANCA negative include henoxinol purpura and cryoglobulinic vasculitis. Now let's discuss eosinophilic granulomatosis with polyangiitis, formerly called Sturge-Strauss syndrome. It is a type of vasculitis that mainly affects adults between 30 to 45 years. It involves heart, gastrointestinal tract, and kidney. Clinical features are asthma, allergic rhinitis, sinusitis, skin nodule, purpura, peripheral neuropathy like wrist drop or foot drop, organ damage like kidney or heart muscle. Now let's discuss granulomatosis with polyangiitis, formerly called Wegener's granulomatosis. This condition is a triad of focal necrotizing vasculitis, necrotizing granuloma in lung and upper airway, necrotizing glomerulonephritis. Clinical features is divided into upper respiratory tract, which include inflammation of the mastoid, that is mastoiditis, inflammation of the sinusitis, that is sinusitis, inflammation of the inner ear, that is otitis media, nosebleed and crusting of the nose, which can result in perforation of the nasal septum. Now let's discuss clinical feature of lower respiratory tract, which include dyspnea, hemoptysis, cough, and kidney problems like hematuria or red cell cast. Now let's discuss henoxinol and purpura, which also called immunoglobulin A vasculitis. It is a rare type of vasculitis that usually occur in children and affects kidneys, skin, or bowel. Clinical features are palpable purpura on buttocks or legs. It is a rash that looks like a small bruise or reddish purple spot. Arthralgia, abdominal pain which is associated with intussusception. Now let's discuss macroscopic polyangiitis. It is a rare and potentially serious long-term type of vasculitis that often affect middle-aged people. It is non-granulomatous necrotizing vasculitis which include kidneys, skin, and lungs. Clinical features are similar to granulomatosis with polyangiitis, which include rash or palpable purpura, dyspnea, hemoptysis, and glomerulonephritis. Now let's discuss Beckett's disease. Beckett's disease can be precipitated by herpes simplex virus or parvovirus. Its clinical features are aphthous ulcer or mouth ulcer, genital ulcer, uveitis, and erythema nodosum. Now let's discuss cryoglobulin associated vasculitis. It is associated with protein in the blood called cryoglobulin, which occur following hepatitis C infection. Clinical features is a triad of palpable purpura or rash on the lower limb, arthralgia or joint pain, and weakness. Cryoglobulin associated vasculitis may also have nerve damage or peripheral neuropathy, abdominal pain, and kidney problems like glomerulonephritis. Now let's discuss hypersensitivity vasculitis. It is usually caused by a reaction to certain medicines such as non-steroidal anti-inflammatory drugs or certain antibiotics like penicillin, cephalosporin, which result in temporary rash. Now let's discuss the last part, that is treatment of vasculitis, which include glucocorticoids and immunosuppressant drugs. Glucocorticoids include prednisolone or prednisone. These glucocorticoids are referred to as steroid and immunosuppressing drug includes cyclophosphamide. Thank you for your patience. If you like the video, kindly share it with your friends. For getting further videos, like this channel, subscribe the channel and press the bell icon so you won't miss any further update.